Buoy Health Insights, pain in the middle knuckle of your finger. Hello viewers, welcome to another episode of Buoy Health Insights. Today we're going to dive into a common but often overlooked issue: pain in the middle knuckle of your finger. Whether you're someone who frequently experiences this discomfort or you're just curious about what might cause it, we've got you covered. The pain you feel in the middle knuckle of your finger is usually due to an injury or inflammation within the hand's joints. Conditions like rheumatoid and psoriatic arthritis are known culprits for causing swelling and that aching feeling in your knuckles. If you're experiencing pain without obvious swelling, you might also notice stiffness, limited mobility in your finger, stretched or shiny skin, or skin that dimples after being pressed. Warmth, redness, or even a visible deformity can also accompany this pain. These symptoms can be signs of something more serious, so if you notice them, it's essential to consult your doctor promptly. Now, let's understand why your finger might be swelling and causing you pain. There can be several reasons, ranging from injuries to infections and even environmental factors. For instance, jamming your finger against a hard object, extreme temperatures, or bacterial entry through a cut can cause inflammation leading to pain. Sometimes, swelling is triggered by underlying conditions like Raynaud's syndrome, which is sensitive to cold and hot weather patterns. Let's focus on a few specific conditions that result in middle knuckle pain. 1. Rheumatoid arthritis. This chronic inflammation disorder attacks the linings of joints, leading to thickening and pain. It's an autoimmune disease, meaning the body mistakenly targets its tissues. Women, especially between the ages of 30-60, smokers, and those with a family history of the disorder are at higher risk. Early symptoms include warm, swollen, and stiff joints that typically develop on both sides of the body. If not treated, it can progress to irreversible damage and deformity. Treatments improve quality of life and can range from medication to surgery. 2. Psoriatic arthritis. Related to psoriasis, this condition can cause your joints to become painful and swollen. Like rheumatoid arthritis, it's an autoimmune condition. Symptoms also include changes in fingernails and joint pain. It can cause permanent damage to joints, eyes, and heart if left untreated. Treatment includes medications and possibly surgery. 3. Polymyalgia rheumatica, PMR. This presents as inflammation, aching pain, and stiffness, particularly in the morning. It usually affects those over 50 and involves muscles close to the center of the body. Prescription steroid medication can quickly improve PMR symptoms. Non-serious finger injury. This is very common and typically doesn't require medical intervention. Ice and rest are usually sufficient unless you cannot move your finger, in which case, you should check for fractures with an X-ray. 5. Middle knuckle finger dislocation. This painful condition occurs when your finger bones are forcibly displaced. Visiting a doctor immediately is advisable. Treatment involves putting the displaced finger back in place, icing, splinting, and medication for pain and inflammation. Remember, if you experience sudden swelling, significant pain, or deformity after an injury, it's crucial to seek medical care promptly to avoid long-term damage. Thank you for tuning in to Buoy Health Insights. If you found this information helpful, please like and subscribe for more health-related content. Stay informed and take good care of your health.